Video introduction, tail docking versus tail amputation in dogs, vet-approved differences explained. Welcome to our in-depth video on tail docking versus tail amputation, where we unravel the distinct purposes, procedures, and implications of these practices, as clarified by veterinary professionals. If you're a pet owner, breeder, or simply an animal lover, this video will provide you with essential insights into these two procedures, what they are, when they're done, and why they matter. Tail docking, often a subject of ethical debate, is primarily a cosmetic procedure, while tail amputation serves critical medical purposes. In this video, we'll explore the historical context, legal considerations, health impacts, and veterinary perspectives behind both practices. Whether you're considering these options for your dog or just want to expand your understanding of canine care, this video has you covered. Let's get started by breaking down the essential differences and diving into expert-approved knowledge that every responsible dog owner should know. Stay tuned. Tail docking versus tail amputation. Key differences. Both tail docking and tail amputation involve removing a part or the entirety of a dog's tail. However, the underlying reasons and methods differ greatly. Let's explore each in detail. What is tail docking? Tail docking refers to the surgical removal of a portion of a dog's tail, typically done for aesthetic or traditional reasons. This practice is common in certain breeds like Doberman Pinschers, Boxers, and Rottweilers, where breed standards may call for a docked tail. Historically, docking was also believed to reduce injury risks for working dogs such as herders and guard dogs. Reasons for tail docking. Aesthetic standards. Some breed organizations, like the American Kennel Club, AKC, include docked tails in their breed standards. Injury prevention. In working dogs, shorter tails were thought to reduce risks of trauma from snagging or stepping. Tradition. Cultural and historical practices have perpetuated tail docking across generations. Procedure and timing. Docking is typically performed when puppies are 2-5 days old, under the assumption that their nervous systems are less developed, minimizing pain. However, this belief lacks substantial scientific support. If docking isn't performed early, it must be postponed until the dog is old enough to undergo general anesthesia, usually after 12 weeks of age. Controversy and legal restrictions. Many countries, including Germany, the UK, and Australia, have banned tail docking except for medical purposes, citing animal welfare concerns. In the US, while legal, it remains a contentious issue, with most veterinarians opposing the practice for non-medical reasons. What is tail amputation? Tail amputation, unlike docking, is a medically necessary procedure carried out to address severe injuries, infections, or diseases affecting the tail. It is typically recommended by veterinarians to improve the dog's quality of life or prevent life-threatening complications. Reasons for tail amputation. Trauma. Severe injuries, such as fractures or deep lacerations, may necessitate removing part or all of the tail. Infection control. Conditions like gangrene or recurring infections that fail to respond to treatment may require amputation. Tumors. Malignant growths on or near the tail are often treated with surgical removal of the affected portion. Chronic pain. Persistent tail pain that affects the dog's well-being may warrant amputation. Procedure and recovery. Tail amputation is performed under general anesthesia and involves careful removal of the affected portion while minimizing trauma to surrounding tissues. Recovery times vary based on the dog's age, overall health, and post-operative care. Most dogs heal within a few weeks, although some may experience sensitivity or chronic pain at the site. Insurance coverage. Unlike docking, tail amputation is typically covered by pet insurance, provided the condition necessitating the surgery isn't pre-existing. Legal and ethical considerations. Tail docking. Many organizations, including the American Veterinary Medical Association, AVMA, oppose tail docking for aesthetic reasons. They emphasize the lack of medical necessity and the pain involved, despite being performed on young puppies. Tail amputation, widely accepted as a humane and necessary medical intervention, tail amputation is supported when it aligns with the dog's best interests post-surgical care for both procedures. Regardless of the reason for tail surgery, proper post-operative care is crucial. Here are some common recommendations. Use an e-collar to prevent the dog from licking or chewing the wound. Administer prescribed pain medications and antibiotics as directed. Monitor for signs of infection such as redness, swelling, or discharge. Follow up with the veterinarian to ensure proper healing. Conclusion: understanding the differences. The debate over tail docking versus amputation boils down to purpose and necessity. While docking is largely cosmetic and fraught with ethical concerns, amputation is a vital medical procedure that can save a dog's life or improve its quality of life. By distinguishing between these two practices, dog owners can make informed decisions and advocate for humane treatment. Whether you're curious about these procedures or considering surgery for your pet, understanding their nuances is essential. Watch the full video to dive deeper into the world of canine health and learn how to give your dog the best care possible. Commentary on tail docking and tail amputation in dogs. The practice of tail docking and tail amputation in dogs has long been a topic of heated debate among veterinarians, pet owners, and animal welfare advocates. Understanding the distinction between these two procedures is crucial, as they differ significantly in purpose, ethical implications, and necessity. Upon reflection, one cannot help but feel a mix of concern and curiosity about how these practices have evolved and their ongoing impact on canine welfare. The controversy of tail docking. Tail docking, primarily conducted for aesthetic or historical reasons, is a deeply contentious procedure. Originally performed on working dogs to prevent injuries, it has since become more of a cosmetic alteration to adhere to breed standards. However, this raises an ethical dilemma. Should a procedure with no medical necessity be imposed on an animal simply to satisfy human preferences? Many opponents argue that tail docking is unnecessary and cruel. Puppies undergoing the procedure are often too young to voice discomfort effectively, but research suggests they experience significant pain. Moreover, the assumption that puppies forget the pain because of their young age lacks solid scientific backing. The enduring prevalence of tail docking in certain breeds, such as Doberman Pinschers or Rottweilers, reflects cultural and aesthetic biases rather than genuine concern for the animal's welfare. The medical necessity of tail amputation. Tail amputation, on the other hand, is a procedure driven by medical necessity. Situations such as severe trauma, infection, or malignant growths warrant this surgical intervention to improve or save a dog's life. Unlike docking, amputation has a clear justification rooted in the well-being of the animal. Veterinarians, when recommending amputation, typically consider it a last resort after evaluating all other possible treatments. The contrast between the two procedures highlights the importance of intention. Tail amputation is a compassionate response to unavoidable circumstances, while docking often serves human interests at the expense of the animal's comfort and autonomy. Broader implications and ethical questions. The broader implications of these practices invite us to reflect on our responsibilities as pet owners and caretakers. The role of organizations like the American Veterinary Medical Association, AVMA, in opposing tail docking for non-medical reasons is commendable. Yet, stronger enforcement of these stances is needed to curb unnecessary procedures and promote more humane treatment of animals. Furthermore, the cultural aspects of docking deserve scrutiny. While some countries have outright banned the practice, it remains legal and widespread in others, such as the United States. This discrepancy calls for a unified, science-based approach to canine welfare, transcending national or cultural preferences. Final thoughts. Ultimately, both tail docking and tail amputation shed light on the complex relationship between humans and their pets. While amputation aligns with the ethical duty to alleviate suffering, docking often challenges this principle. Moving forward, increased public awareness and veterinary advocacy are essential to ensuring dogs receive the care they deserve, care that prioritizes their health, comfort, and quality of life over arbitrary standards of appearance.